Namaste everyone. Today I am going to discuss about low back pain. Low back pain is one of the most common symptoms that every human will suffer in one or other phase of his life. It is one of the most common lifestyle disease which is affected equally to both working class who are doing strenuous works and those who are doing office works. So, we know our back spine is a well organized structure of vertebral bonds, intervertebral disc, ligaments and nerves. Any trauma, any sprain or any degeneration to this structure can cause pain in back region or especially in the low back region. So, first of all I want to discuss about the common presentations of low back pain, like how it is presented in the body. It can be a dull aching pain which is limiting to the low back region. Sometimes it can be a burning type of sensation which is presented in the paraspinal muscles, that is side muscles in the back. Sometimes it will be a radiating type of shooting pain or electric shock like sensation which is radiating to the lower limbs. In other times it will be a simple muscle spasm or muscle tightness to the low back region. In some occasions it will be severe pain when patient is trying to sit straight or trying to walk or stepping up stairs. In some occasions there will be difficulty in turning on the bed and even the patient will not be able to walk without support. Next I would like to discuss in detail about the 6 major pathological causes for low back pain. The first one is mechanical low back pain due to muscle spasm. The second one is radicular low back pain due to intervertebral disc prolapse. The third one is degenerative spondyloarthropathies like cervical spondylosis and lumbar spondylosis. The fourth one is inflammatory arthritis like rheumatoid arthritis or ankylosing spondylitis. The fifth one is fracture of vertebral bonds, sometimes associated with listhesis of the vertebral bonds, that is the displacement of the vertebral bonds. And the last one is referred pain, mostly due to kidney stones or ulcerative colitis. So, let us discuss these 6 pathological conditions in detail, and the first one I told was mechanical low back pain. Actually 70 to 80% of the low back pain which is getting in our OP setup is mostly mechanical low back pain. It happens mostly due to sudden movements of the spine, or sometimes due to mild trauma, or sometimes due to sports injuries like sudden twisting or tilting of the spine. So, normally this mechanical low back pain reduces within 6 to 8 weeks, that is means 1 to 1.5 months with minimum medical management. Simple level of anti-inflammatory level of medicines and a simple oil application is needed in mechanical low back pain. The second one is radicular low back pain that happens due to the nerve entrapment due to the prolapsed intervertebral disc. So, before that we need to understand what is the intervertebral disc. Actually we know these vertebral bonds are chained bonds which are organized in our back region. So, in between the intervertebral bonds there is a cushion like structure which is having a jelly like protein structure which is covered by a fibrous layer, that is the intervertebral disc. This acts as a cushion between the 2 intervertebral bonds. So, any trauma or any pressure to this intervertebral bonds that causes the protrusion of this jelly like structure which comes out and it presses the outgoing nerves from the spinal canal, and it also can cause a compression to the spinal cord itself, that is called the cord compression. When the prolapsed intervertebral disc is pressing the outgoing nerves from the spinal canal, that always create a shooting type of pain or electric shock like sensation to the lower limbs. So, that is if it is entrapping or it is pressing the sciatic nerve which is going through the posterior of the of our leg, it is called sciatica, which is very known to everyone. So, that is a pathology of radicular low back pain due to the prolapsed intervertebral disc, and in some condition it as I told earlier, it presses the spinal canal itself and it will compress the spinal cord. So, this will cause weakness or numbness to the lower limbs or to the genital organs. So, this is a very serious condition which need emergency medical care. The third common pathological cause of low back pain is the degenerative spondyloarthropathies like lumbar spondylosis or cervical spondylosis. This is actually a degeneration like wear and tear changes of the vertebral bonds, where the intervertebral bonds and intervertebral disc are getting degenerated, and there will be changes in the space between the intervertebral bonds. So, this always cause pain and inflammation to the paraspinal muscles, and in aggravated condition, if the space is very much reduced, that can cause this same intervertebral disc prolapse, and that can cause this radiating type of pain and all. So, if it is affecting the low back region, it is called lumbar spondylosis, that is a degeneration of the lumbar spine. If it is affecting the cervical spine, the structures which is coming in the neck region, that is called cervical spondylosis. The fourth pathological cause is inflammatory arthritis like rheumatoid arthritis or ankylosing spondylitis. This rheumatoid arthritis is an autoimmune inflammatory condition that normally affects all the major and minor joints of the body. If it is affecting the spinal joints, that is called rheumatoid arthritis of the spine. So, there doctor will be diagnosing your case with using inflammatory markers or antigen antibody tests like RA factor, anti-CCP, etc. And the second one is the inflammatory arthritis called ankylosing spondylitis, where the vertebral bonds get fused and the movements of the spine is restricted. The patient will not be able to do the regular movements of his spine. It can either be in the cervical spine or in the lumbar spine, and it will be associated with severe pain. So, in ankylosing spondylitis, one of the confirmatory tests is HLA-B27 antigen test, and also other inflammatory markers will be used for the diagnosis of the case. And the fifth pathological cause for low back pain is the fracture of the vertebral bonds. It may be sometimes due to road traffic accidents or heavy trauma to the back bones. And this is very common in elderly people who are above 50s, where the bone will be very fragile, and any minimal trauma to this vertebral bonds that causes the fracture of the bone. And it will be mostly associated with the listhesis of the spine. Listhesis means the displacement of the intervertebral bonds. So, this displaced bone always sometimes compress the nerve canal or the spinal canal, and which causes numbness and weakness of the lower limbs and upper limbs. And last pathological cause is referred pain due to kidney stones or ulcerative colitis. That is because that the pathology will be in any other sites like kidney or in the intestine, but the pain will be felt in the low back region. In that condition, the differential diagnosis of cause of the disease is very important. We have to take needful investigations like USG abdomen with KUP or endoscopy to differentiate the cause of the disease. Now, let us see what Ayurveda tells about this low back pain. In Ayurveda, this pain in low back region is referred as Kadi Shula or Kadi Graha. That is based on the location of the pain. If it is affecting the upper spine or in the neck region, it is called Griva Graha or Griva Shula. So, most of the medicines and treatments are focusing on reducing the inflammation of the paraspinal muscles, strengthening the vertebral bonds, and rehydrating the intervertebral disc. Which is very important in managing the low back pain according to the pathological condition. We are having specified treatments like Taila Piju, where oil soaked cloth is placed on the affected region, Kadi Vasti, where warm oil is kept stagnated in the affected region, and we does Pidichil or hot oil pouring on the affected region that will help to relax the paraspinal muscles and help to adjust the space of the intervertebral bonds. And specified kiris or potalis or hot poultice, it can either be hot potalis, that is podikiri, which helps in relaxing the muscles, or sometimes navarakiri, that is the rice potli or rice poultice, which is very helpful in strengthening the paraspinal muscles and bonds. And before going for a treatment of low back pain, we should clearly diagnose and identify the real cause of low back pain, and treatment should be customized according to the pathology of its origin. It should always be done under a qualified medical practitioner who is able to diagnose it clearly and do the treatment accordingly. Thank you.